Well, environmental degradation has been so extensive, as we know, and climate change specifically has been increasing the number of deaths and the number of disease burden. Especially special attention has been put in the shifts of spatiotemporal distribution of infectious diseases as they are producing a change in the distribution and the frequency of them. If we should consider especially a group that is very important and importantly related to climate change is the neglected tropical diseases. Neglected tropical diseases are a group of infectious diseases that affect mostly developing countries. We include there Chagas disease, dengue, hantavirus, leptospirosis, leishmaniasis, malaria, among others, and they affect the world's poorest. The World Health Organization estimates that more than 1 billion people is affected each year by these diseases, and more than 500,000 each year die as a cause of them. But besides those numbers and the importance, social importance and health importance that they have, these diseases attract less than 1% of the total health funding for developing countries. So besides thriving in poverty, these diseases are said to be also poverty promoters, as they decrease workers' productivity and also impair childhood development, therefore affecting the future earning capabilities of them.
And some of these diseases are diseases for which there are cures, but a cure, an injection, is not necessarily the only method to reduce these diseases. Tell me a little bit more about that.
Well, there are basically Mundo Sano works to diminish the burden of neglected tropical diseases, and there are several ways to do so. Mundo Sano has a very strong strategy to do that, creating working platforms, generating evidence, working with the people with a very strong technical component, and going back with the governments, working on policies to produce new policies that contain a higher body of knowledge. When needed, Mundo Sano established operational centers in the affected regions, working with the people through education, through research, and of course with a daily commitment to working with them to teach them how to modify their reality. For some of those diseases, we have drugs. For others, we have measures to take. But just to put an example, there are several problems. There are some barriers, multiple barriers. For instance, there are barriers for the drugs sometimes to reach the affected populations. In that case, Mundo Sano goes there and acts on that, trying to solve the problem, and it does so. It's a very good method, proven method, reliable, sustainable, and also, and the most important thing, can be replicated anywhere. And so we have been looking for, and we constructed alliances, partnerships, and today we are recognized as one of the central partners in an increasing web of organizations that are fighting against neglected tropical diseases.
So there are issues, obviously. You started in Argentina, Latin America, so your work is now spreading. There is a need for these kind of measures to be implemented around the world, developing countries around the world.
Yes, it started in Argentina in 1993, founded by Dr. Roberto Gold, but with the aim of constructing conscious about these neglected tropical diseases and constructing alliances and partnerships in the understanding, because they understand the difficulties and the complexities of the problem, and we went global in the understanding that unity makes strength. Today we cooperate with several organizations around the world, and we are very happy to do so, but we still need more cooperation. We need more hands, more brains, more funding to work against this group of diseases that are affecting so many people, and this, unfortunately, they affect the world poorest.
And what's the message you bring here to COP18 at Doha, and what do you hope to see out of this conference?
Well, this summit, I mean, is the best place to say that we should pay attention to how climate change is causing an increase in the number of neglected tropical diseases, that we should take action, and that Mundo Sano has been doing so for more than 20 years and has a method that can be used anywhere in the world and that is sustainable, and that we are open to alliances and partnerships to keep constructing a better world, because we have Mundo Sano has a paradigm shift that more health for more people will construct a safer, healthier, more equitable world.